5 countries in Africa have 0 trained oncologists. Not a shortage, 0. Sub-Saharan Africa has 1 cardiac surgeon for every 4 million people. In South Africa, more than 34,000 patients are waiting for surgery, some for over 5 years. Now pause for a second. What does that actually mean for a patient? It means being diagnosed, but not having access to treatment. It means waiting, when time is the most critical factor. And this is why thousands of African patients travel to India every year for medical care. Today, we're going to look at the data, the gaps, the costs, and what options actually exist. Africa has 24% of the world's disease burden, nearly 1 in 4 sick people on Earth, but only 3% of the world's health workers. So what does that actually mean for a patient? It means a mother might visit multiple clinics before getting a diagnosis. It means treatable conditions become life-threatening simply due to delay. Only 5% of Africans have access to safe surgery, and nearly 80% of health facilities lack reliable access to oxygen. Think about that. A basic requirement, oxygen, isn't guaranteed. Now consider cancer care. Around 80% of cases are diagnosed at advanced stages. Fewer than 30% of patients receive treatment. In high-income countries, that number is closer to 90%. Here's what that looks like in reality. Breast cancer survival in Europe is 82%. In Gambia, it's 12%. Same disease, completely different outcome. But why? Because access, not medicine, is the difference. And behind that is funding. Healthcare spending averages just 7.4% of national budgets. Less than 20% of people have insurance. So for millions of families, a diagnosis doesn't just mean fear. It means financial risk. Around 150 million people are pushed into poverty each year due to healthcare costs. So the gap isn't just medical, it's systemic. And then there's the people needed to deliver care. Doctors, nurses, specialists. Across Africa, many are leaving. In Nigeria alone, roughly half of licensed doctors have immigrated. Over 75,000 nurses have left since 2017. The WHO estimates 1 in 4 physicians will leave the continent. But this isn't just about numbers. It's about what happens to the patients who stay behind. Imagine needing a specialist and finding out they're no longer available in your country, or that the waiting time is years long. The reasons are complex: limited infrastructure, lower salaries, unsustainable workloads. So the system stretches thinner and thinner, and eventually patients start looking elsewhere. Platforms like Aradia see this every week. Patients who aren't choosing to leave, but feel like they have no other option. Nigeria alone spends over $500 million every year on treatment abroad. For patients with urgent needs, waiting isn't always possible. So when treatment isn't available locally or isn't available in time, patients begin to look beyond their borders. One of the most common destinations is India. In 2024, India treated over 7.3 million international patients. Around 8 to 10% came from African countries, primarily Nigeria, Kenya, Tanzania, Uganda, and Sudan. There are a few reasons for this. One of them is cost. Heart bypass surgery, India, around $7,000. United States, around $120,000. Knee replacement, India, $5,000. US, $35,000. Across procedures, savings can reach 60 to 90%. But cost alone isn't enough. India has over 50 internationally accredited hospitals. These facilities perform complex surgeries, organ transplants, cancer treatments, robotic procedures, at a scale that isn't widely available in many regions. And importantly, The system is built to support international patients. Faster medical visas, dedicated coordinators, structured care pathways. But behind every number is a decision. A parent trying to find treatment for their child. A patient navigating a diagnosis without clear options. For many, this isn't a preference. It's the only path forward. At Arodia, the first question we hear is simple. Can this be treated? Followed by, what will it cost? So where does this go from here? The reality is, both things need to happen at once. Patients need access to care today, and healthcare systems need to grow for tomorrow. Medical travel helps bridge that gap, not as a replacement, but as a current solution. At the same time, there are signs of progress. Health tech is growing. Partnerships are forming. Access is slowly expanding. If you or someone you know is considering treatment abroad, the most important step isn't choosing a country. It's understanding your options clearly. What treatment is actually needed? Which hospitals are right for your case? And what the real cost will be. Don't rely on guesswork during something this important. Get a verified plan first. If you have questions or you're navigating a situation like this, you can reach out through our website, www.arodia.com, or share your experience in the comments. And for more clear, data-driven insights on global healthcare, consider subscribing. Thank you for watching.